There are many procedures that might help us dealing with male factor during fertility treatments. Some of them will help us during the diagnosis of this male factor. Some other will help us during the treatment. For the diagnosis of male factor and to avoid the problem, the chance of failure during fertility treatment, sometimes we need to do specific semen analysis more than spermiogram. There are two which are the most important, which is sperm fragmentation, which is used to determine the degree of damage on the DNA on sperm samples, and the other one is FISH on sperm samples that will help us determining if there is any chromosomical abnormality in that semen analysis. Those studies will help us especially in those patients that have had many previous fertility treatments that didn't achieve to give us a baby at home. DNA fragmentation usually is studied in those patients that have had repeated miscarriages, and if there is a high degree of DNA fragmentation, there are some medical treatments that the andrologist can offer to the patient to try to reduce this problem and then increase pregnancy rates. FISH study on sperm samples is used to try to determine if there is any chromosomical abnormality in this spermatozoa that might give us abnormal embryos and especially implantational failure or repeated miscarriage because of these abnormal embryos that are created from abnormal spermatozoid. In some cases, we need to undergo testicle biopsy to do also meiosis on testicle tissue and make sure if there is any chromosomical abnormality also in spermatozoa when FISH is normal. Once we have the diagnosis and we know which is the main problem in this male factor, there are some procedures during the fertility treatments that might help us increasing the chances of a pregnancy and reducing the chances of miscarriage. They're based on sperm selection. Some of them, they're based on morphological study of spermatozoa, like IMSI or PIXI, that will help us magnifying the image of the head of the spermatozoa and choosing the normal forms, especially in those patients that have a high degree of abnormal spermatozoa on their semen analysis. We consider that we can use this technique when there is less than 4% of normal form in the semen analysis, and this will help us reducing especially miscarriage rates. When we use other techniques like fertile, that will help us doing a sperm selection, especially in those cases with high fragmentation, or in these cases where we detected chromosomical abnormalities in the semen analysis. And this technique will help us selecting the best spermatozoa to try to get the higher pregnancy rates and the lower miscarriage rates.